Hello, my name is Ashlyn Baker, and today I'm going to be demonstrating how to change a colostomy appliance or an ostomy appliance. So I did go ahead and identify my patient with two identifiers, and she is alert and oriented ×4 to person, place, time, and purpose. I did go ahead and listen to her bowel sounds. She is new. So she doesn't have any supplies from home that she would prefer us use. So she is learning this now, and she will be doing the one tomorrow. So she's eager to watch me. So if you see her looking down, watching what I'm doing, she's eager. She does not have any disabilities that will cause like rigidness or any eye issues that would be issues with seeing. She doesn't live alone. She does have grandchildren, and they will be here to watch her tomorrow as well, just in case they want to learn. So I am going to go ahead and look at the site, and for demonstration purposes, we're going to pretend that this one is not here. That would be an ileostomy, and we're looking at the colostomy right here. So there is no abdominal incision, and then of course I would assess for irritation, redness, signs of infection. The stoma is red and moist, and she does have contents in the bag, and we will empty those. She's not in any pain, so I am just going to go ahead and cover her back up real quick. And now I would perform hand hygiene. And this isn't the first change, so I'm gonna kind of just do some highlights, but she does know the steps. Hand hygiene, and I'm going to perform my apply my gloves. And for demonstration purposes, I'm just going to voice when I would change my gloves, because we do not have a lot of gloves. So I'm going to place my protective barrier over her, of course don't want to get any on her. And these are not surgical gloves. Okay, good deal. And of course, if it was full, I would empty it into a bedpan and then rinse it out and measure it, or if it had any at all. But for this, she doesn't. So now we would use our wipes to remove the wafer that she already has on. And just gonna pull back, not causing any irritation. And I would discard both of these into the biohazard bin. But for demonstration purposes, I'm just going to set it over here. And then now, of course, I would use my special cleaning wipes. I have a pH of 5.5. And going to clean the stoma. Demonstration purposes, we're just going to pretend that these are that. And just getting a real good look at the stoma. It is nice and pink. There is no skin breakdown, no lesions, and she's not in any pain. So I'm going to clean, move to a new area, and clean. And of course, I would have swapped my gloves right after I discarded that and performed hand hygiene, and would have applied them in the beginning cleaning. Cleaning around and discarding in the biohazard bin. Okay. Placing these out of the way. And of course, I'm going to apply the gauze. That way there isn't any leakage. So we've got that placed on there. Now I would remove my gloves and perform hand hygiene. So now I will get my skin protectant, and it can be powder, it can be, some people use skin tack, and it just helps it stick better. So I am going to go ahead and measure, and of course I did change my gloves, I can't remember if I said that. Remove my gauze, discard to hospital policy and the biohazard bin, and measure my stoma. Okay, we don't want it too big and too little. So the 31 millimeters is just slightly too small. So we're gonna do the 35 milliliters. Okay, so I have my measurement. Going to sit that down. And going to grab my other gauze and place on there again, preventing any leakage on her. So now I'm going to open my wafer. That is not wanting to open. And of course, I would use my pen right here and going to trace. And I said it was 35 milliliters. So we're going to trace, make sure I'm in the camera, trace around so I know where to cut. Okay. And now I'm going to begin cutting my wafer. And we don't want any rigid edges because that might cause skin breakdown, and we definitely don't want that. Okay, placing my scissors down and removing the piece that I cut out. Now we want to place it in our hand for 30 to 60 seconds. It's going to warm it up. And I just want to smooth out the edges, that way again we don't have any rigid edges. So smoothing out my edges here. And some wafers come connected already to the bags, but this one is separate. Okay, my wafer is ready to go. Now I'm going to take my bag and I'm going to apply my clamp. If it would, there we go. And we're going to do 2 half turns. Because if we have it too full, then the bag could, if it's not clamped right, it could leak out. And of course we don't want that to happen. So now you can connect your bag to your wafer. Okay. And set that to the side because that is going to be ready to go. So now we can remove our gauze, and there is not excessive draining, but we do want to prevent skin breakdown, so we're going to apply powder or skin tack, whatever she's preferred. We're doing powder today, we did skin tack yesterday, that way when she'll know which one she likes more when she goes home. Rub it in, we don't want any skin breakdown. And she's doing good. I have monitored her. Okay. Now we're going to remove the adhesive backing. You can also get extra adhesive. They come in little rings that you could break apart and it just provides an extra seal. They are really common when people have abdominal incisions, but she does not. So now we're going to line the wafer up around the stoma perfectly and push down. And then we're going to apply our hands here for 30 to 60 seconds again, which allows better sticking and longer lasting of the bag. And that is one thing I forgot to mention earlier. It has been 3 to 5 days since our last bag change. So, because we're trying to be cost effective, and when she gets home, I did check her insurance, and it is going to be coming out of pocket. So we want to help her with that. And she is looking, she's eager to learn. Okay, and she is having a little bit of drainage. The draining looks normal. There is no malodorous odor. Okay, bag is secure. Asking her how she feels. Okay, gonna remove my gloves and perform hand hygiene. And then I'm going to reapply my gloves, and I will pick up my station that I then will be discarding everything into the trash. And I'm not sure if I mentioned earlier, but the bedpan is what I would have used if there would have been feces in her bag, but for demonstration purposes, I can go ahead and show you what I would have done. I would have placed it on the side of the bed, of course, with the protective barrier underneath, and I would have pushed it to the end, drained it, and then I could have, if it would have been pure liquid, I could have measured it in a graduated cylinder and got an exact output, which is what I would have done. But she is good to go, so I'm going to go ahead and remove all of my supplies and discard in hospital policy and the biohazard bin. Asking how she feels, and she's doing good. And I did lay her down that there was no abdominal folds earlier. I think I forgot to mention that. So I am going to go ahead and raise her bed back up and get her in a comfortable position. Bed is in the lowered locked position, and she does have her call light. And then I would remove my gloves and perform hand hygiene. Thank you.